Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Welcome back, everyone. We're here today with our first Cabral House Call of the weekend. I hope you had a great last week, that you're excited to, well, get into the weekend. And if for you, if that means not working your typical day job, if it means a little bit more relaxation, I hope that you do get to enjoy yourself, friends, family, loved ones, take a little downtime. That's never a bad thing. You can always get back to those goals and everything that you want to achieve in your life on Monday. Sometimes it's nice just to take a couple of breaths, relax, and enjoy life. So let's get into now our first house call of the weekend, where we answer our community's questions each and every weekend, and they're always answered in the order they come in. So we're starting today with, let's see, it's Paula, and she wrote in on 4/29. So we're answering this on 6/26. So June 26th, so about 8 weeks or so behind on your questions. And, we have seen a lot more questions come in, even though I'm doing office hours once or twice a month on Instagram. So if you're not following me on Instagram, I answer questions there as well, live. Hopefully you check that out. That's just my name, Stephen Cabral. And we put that in our Facebook group as well. That's cabralsupportgroup.com. And of course, we answer questions every single day inside of that support group. But I just want you to know, so just be patient. If you did ask a question, I'm always going to get to it no matter what. And it will be answered just in the order they come in. So let's get started. Paula's up first. Paula says, thank you so much for your incredible work. I'm an IHP level 2, so I did learn a lot about exercise. However, I was reading Awaken the Giant Within by Tony Robbins, and I'm not sure if I agree with the section where he talks about exercise. He says that anaerobic exercise burns glycogen as the main source of fuel while causing the body to store fat, but aerobic, however, burns fat as fuel. He talks about the problem of people pushing themselves beyond their heart rate in an anaerobic state, and that this is dangerous because the body shunts blood from critical organs because it needs to that immediate demand for blood, and so these organs lose large amounts of oxygen. According to him, wind sprints create an immediate oxygen deficit in the cells and begin to train your metabolism to burn glycogen or sugar, but that fat continues. Apparently, the key is to burn fat and not sugar. Very confused now, as I thought workouts such as tabatas were very effective to burn fat. All right, Paula, happy to answer this. The main issue, and I love Tony Robbins, and there's no doubt about it. Love Anthony Robbins. I think his work's phenomenal. His mentor, Jim Rohn, is one of my favorite, if not my favorite, inspirational guru of all time. I just think Jim Rohn was so down to earth and just said, listen, these are normal. I just love Jim. I just love Jim Rohn's material. I really do. It's old school now. I never got to meet Jim Rohn. It was kind of before my time, but luckily his words live on, and you can listen to his MP3s, which have been converted from CDs, which I used to listen to back in the day. And of course, you can find them on YouTube as well. But so here's the thing, though. Tony Robbins is an amazing, inspirational, and beyond that, teaches you a lot about neuro-linguistic programming, et cetera. But this is not his specialty, right? So this is not his specialty. Because what he's saying on a surface level is absolutely correct. But it's this thing I talk about as peeling back the onion, right? This is peeling back the onion. So aerobic means when you're in the aerobic zone, your body is able to use oxygen. It's able to use body fat as a fuel source. It still uses some glycogen as well. So that's what people don't tell you, because you don't completely switch one to the other. However, when you're at your absolute maximum, well, if you're at low level anaerobic, you get to use some oxygen, you get to use some fat, you get to use some glycogen, some sugar. That's not a bad thing, right? And then when you're at max capacity, all out sprints, yeah, you are actually shunting blood, and you are using glycogen as a fuel source. There's no doubt about that. But we have to take this into perspective. Your sprint is going to last 30 seconds, like maximum, maybe 60 seconds, like maximum. And how many are you doing those per workout? If you're doing a 30-second, you might be doing 8 or so, right? 8 sprints. Maybe you're doing less. If you're doing a tabata, how many are you doing? Well, you're doing 20 seconds on, 10 seconds off. You're doing it for 4 minutes only, right? That's it. And you're on for 20, off for 10, right? So that's how that's working specifically. So 8 total rounds. And if you're doing the 60-second sprints, you're not doing 8 of those. Like that's crippling on the body, right? Like that's really hard. So what are you really doing? Well, for that 4 minutes of time, you're in more of an anaerobic zone. There's no doubt about that. But you're out of that anaerobic zone within a maximum of 3 minutes maximum. And then you're in the aerobic zone because your heart rate has to recover. And then you're back to baseline normal. So you are burning body fat. It's not that you're not. You are pushing your body. But here's the thing. What Tony Robbins didn't tell you is that the high intensity interval training or sprint interval training, which is what we're talking about here, it is different, that you are also helping your body to build more mitochondria. Those mitochondria can use oxygen, they can use glycogen, just like they should. And your body, it's been actually clinically proven that even without doing aerobic-based work, if you do anaerobic sprint interval training, you can improve overall growth hormone, mitochondria, burn more body fat, improve muscle tone. So again, it's all about surface level versus going deeper. So actually you didn't check out this show before you wrote this, but I hope that you tune into it. It's called Fat and Slow Weight Loss. And I hope that you check that out. I'm going to actually find the show for you. This is important. It's episode 1952. All right. So Paula, check out episode 1952. It'll teach you why you should use both aerobic, which is slower cardio, and anaerobic, which would be sprints or interval weight training, to burn body fat. They both work, right? They both work. So I want to teach you why you need both, all right? So that's the longer answer there at 1952. But again, no disrespect to Tony Robbins. He's amazing. Absolutely, I think he's fantastic. But he's not a certified strength and conditioning specialist. That's not what he does. And by the way, he does breath work that's pushing his body into more of that stress-based state, because I've seen his morning routine. So take everything with a grain of salt. That's all. All right, Elizabeth's up. Hi, Dr. Paul. What makes eyes or an eye tearing in sunlight? My left eye seems to almost always tear at the outer corner when it is in the sun. Sometimes it won't stop. My eyes seem to be a little sensitive, nothing I've been able to deal with. For example, I looked out the window the other day. I suddenly had blurry and dizzy feeling to the point where I couldn't look at anything. I'm not great with fluorescent lights either. There's a chance I could possibly be anemic, so I'm not sure whether that's it or should I use a dry eye supplement. Can't really recall how long this has been happening. If I wear sunglasses, it seems to be okay. But I've been told that my eyes need to be exposed to some level of sunlight. Thank you for all you do. Thank you, Elizabeth. Great question. Believe it or not, I used to have this back in the day. It was when I was sick for about a decade or so. And it has a lot to do with neurological overload. And for some people, mast cell activation syndrome or histamine issues, which are worse in the sunlight. However, it has a lot to do with neurological issues, with the actual pupil dilating and constricting, and it overwhelming the system. Now, remember, if your pupils if you're not constricting properly in the sunlight, what does that cause? Well, it can cause actual damage to the eye itself, to your, I believe, retina. It's allowing in too much light. So what does this mean? Well, a real protective mechanism for your body is to produce mucus or tears to help basically blur that light coming in. And that's one way to look at it. I can't give you a medical diagnosis for this, but I can tell you that until I read your question, I forgot that used to happen to me all the time, especially in college. I remember when I would leave my dorm room or leave the cafeteria, my eyes would start to water. And on normal days, sometimes they wouldn't water, it might be cloudy, I would walk into the cafeteria and immediately my eyes would start to water, and I'm in this big line of people, and literally, for me, it was my right eye would start to water. And so it takes me back a little bit. I'm happy to say that hasn't happened to me in, as they say, a million years. So it can be overcome. I would really look at things like the big 5 lab tests. I would look at what's going on inside of your body. And again, all labs and protocols can be found at equi.life. That's equi.life. All right, Vera's up next. Hello, Dr. Paul. I've noticed that from time to time, I get heart palpitations at the same time when I feel bloated. It actually often happens just before I burp or pass gas. Do you think it's connected? And what could be the cause of it? And the best remedy. Thank you in advance for your answer. Best, Vera. Vera, happy to answer this. For the most part, when you get heart palpitations connected to the digestive system, it is a food sensitivity, or it, as you just said, it's pressure, right? It's pressure on the nerves around your stomach, sensing the discomfort because you're full of gas in your stomach. That discomfort leads to a stress response in the body. And when there's a stress response in the body produces norepinephrine or adrenaline, and the heart rate starts to speed up a bit. So that's most likely a connection there. There is definitely a connection between histamines or food sensitivities and increased heart rate. So I just want you to let you know that as well. And I would recommend the 3 digestive lab tests. In order of importance, they would be the Candida metabolic and vitamins test, then the bacteria and parasite stool test, and then there would be the food sensitivity test, the IgG food sensitivity. Again, all of those are over at equi.life. All right, Lindsay's up next. Hi, Dr. Paul. I've been on long-term antibiotics for approximately 9 years, ever since getting married. I have celiac disease, and from listening to your podcast, I've found IHP here in Australia to work with, as I'm sure I have some terrible gut problems. I'll be starting the CBO protocol soon, and I'm awaiting for my starter lab test kit. But I had been taking an antibiotic after having sex to avoid a UTI. I purchased your UTI protocol with the idea that while I'm working to correct my health, I could possibly use it in place of the antibiotic. The last thing I want to do is be on antibiotics while trying to get better. Does this sound like a good plan to you? Previous to the regular antibiotics, I had a UTI at least once per month, so have been taking antibiotics for my entire married life, 16 years. I've listened to your podcast about UTIs, but I'm not sure any of them directly relate to my issue. Any insight would be great. Thanks. Okay. Lindsay, happy to help with this. UTI stands for urinary tract infection, not uncommon at all after sexual intercourse. Let's go into a couple reasons. By the way, I'm so happy that you looked up an integrative health practitioner near you in Australia. By the way, anybody can find an integrative health practitioner near them. All they have to do is go to integrativehealthpractitioner.org and click on practitioners, and you're going to find a level 1 or level 2. Level 2 are able to get you the lab tests. So it's that. Okay. Urinary tract infections can happen from a change in the actual bacteria in the vagina. So it can go from being more acidic to more alkaline. That can create bacterial vaginosis. It could create a urinary tract infection. At worst, it can also create a kidney infection as it begins to move up to the kidney from the bladder. So what are we looking at? Well, the healthy urinary tract protocol that I do recommend, again, this is not a medical treatment protocol, is at equi.life. That's the D-mannose. That is the apple cider vinegar, that's the citrucidal drops, and it's the ascorbic acid. Can't be alkalizing vitamin C, has to be ascorbic acid. Can't be food-based vitamin C, has to be ascorbic acid. All of these things work in their own way. I've explained that before on that protocol. The D-mannose helps to unlock a lot of that bacteria in the bladder itself. The vitamin C is acidifying, which moves out a lot of that bacteria. And the apple cider vinegar in the same way, and the citrucidal is great for bacteria as well. It's a great protocol. I mean, people use it all the time, typically recommended for 72 hours. Again, it's not a medical treatment protocol. I can't give medical advice. I can't cure disease. I can't diagnose disease. I can't treat disease. All right, that's my statement. Those are all my disclaimers. Now, here's the thing though. So a lot of women, what they like to do, what they choose to do is insert vaginally a little bit of coconut oil before sexual intercourse. And what that does is it actually works to add acidity, but also what it helps with is to block a lot of the bacteria, because coconut oil is naturally antibacterial. So it works for many women, and that could be helpful. So you may want to try it if you choose to. And another thing is they make sure that they urinate directly after having sex, like within a minute if possible. And part of that is to acidify. Urine is acidifying for in and around the vagina itself. and that seems to help as well with also emptying the bladder. Again, this is more anecdotal, but when hundreds of women that you work with tell you that this works in your private practice, then why not share it with others? All right. So Lindsay, hopefully that's helpful. And no doubt about it, I would look at what your integrative health practitioner is helping you for that starter kit and also the CBO protocol. All right. Kelly's up. Kelly says, I'm a 52-year-old female weighing 190 pounds. I'm 5'5". A recent MRI has shown marrow edema underlying the calcaneal attachment of the distal Achilles tendon. I'm an active person currently trying to lose 45 pounds, and I don't like taking ibuprofen. Is there any natural protocol, supplement, essential oil, massage techniques, etc. I could try to relieve the edema or assist this bone marrow issue? Any suggestions is appreciated. Thank you so much, Kelly. Okay, happy to answer this for you. If people are wondering what the calcaneal attachment of the distal Achilles tendon is, it's basically your heel. So your Achilles tendon goes from your calf all the way down to your heel. It's called the calcaneus. And which this person has edema. Kelly has edema there. Okay, what can we do? Well, part of it is there's a lack of mobility in the ankle. So you actually need to work on ankle mobility more than you need to do on just working on flexibility for the Achilles. Definitely work on flexibility for the Achilles, but don't overstretch it, especially if there's some scar tissue or there's a lack of mobility, right? So mobility, you can work on ankle circles, both directions. Some people have you write the alphabet with your big toe. You'll also want to work on what's called plantar and dorsiflexion. All of these can be looked up for YouTube videos. So look on ankle mobility, look at plantar and dorsiflexion, and then what we need to do is work on massage as well. So I would use our CBD pain relief cream, which should be out very, very soon. That's at equilibriumcbd.com. Equilibriumcbd.com is for all of our organic CBD oil. I would do self-massage on that twice a day with that. Of course, I would just take your regular daily foundational protocol-based products. You could use the advanced collagen support as well. These are all at Equilife besides the CBD. The CBD has to be on a separate website, which is equilibriumcbd.com. The rest of it's at equa.life. And I would also stay off it until you work on the mobility, but also that you're losing the weight. And I know it's kind of like a double-edged sword because you want to do more walking, but you don't want to exacerbate this issue. So I would do an upright bike for now. It's going to get some of the pressure off the Achilles. And then I would do a 21-day functional medicine detox, because that 21-day functional medicine detox, I mean, you could lose 15 plus pounds in 21 days. And then we teach you how to keep it off as well. So yeah, I would do the 21-day functional medicine detox. I would do then the Fatlocity program after that. It's Fatlocity. You can check that out over at Equilife. You're going to lose that weight. I mean, I think you could lose that weight in 4 months. I really do. I think you could. What's that? That's 6 pounds. Yeah, 5.5 pounds a month. I think you could do that in 4 months, 6 months maximum. And that will then take the weight off of that heel as well. So hopefully that's helpful. Again, you can always find a good muscular therapist. You can find a good chiropractor that does active release technique. You can watch some YouTube videos on ankle mobility, and hopefully that's helpful. One more question today is from Sophia. Hi, Dr. Ball. For many years, I've had this weird itchiness around my lower abdomen, right underneath the belly button and across my gut, usually a couple minutes after I eat. This sensation is usually also accompanied by bloating and just general discomfort in my body. I always get choked. I always chalked it up to body dysmorphia. But I'm wondering now if it could be epidermal inflammation from the food I'm eating. It seems like the itchiness is right in the adipose tissue around the area, which is super uncomfortable. I don't have a rash or hives or any discoloration. Thank you for your thoughts. Happy to answer this. Yes, it is typically a food sensitivity. So here's the thing. Most people never get this itchiness underneath their belly button, about 1.5 inches below. They never get it unless they're eating food, right? So what do? Well, we don't never eat food again. Well, no, that's not it. So here's the thing. It's typically a food you're eating. So what you want to write down is you keep a food journal, right? Go back to my podcast called The Rotation Diet. All right. So go to stephencabral.com/podcast, type in rotation diet, check that out, keep a food journal, see when it comes on the most. And then for you, I can't recommend enough running the same gut test that I talked about earlier, the Candida metabolic and vitamins test, the bacteria and parasite stool test, and the IgG food sensitivity test. You want to look at what's going on inside of that gut, because something's leading to some type of cytokine production, leukotriene production, histamine production, etc., that's causing this itchiness. All right. So hopefully that was helpful. Of course, if it was, please do feel free to share it with anybody else it could serve. And come on back tomorrow. We'll be answering more of our community's questions. Thank you so much for tuning into today's Cabral Concept. Appreciate you. I truly do. And I want to make sure that you know all about our brand new hormone labs that have debuted this week. They are typically $129, which is a very low cost for an at-home lab that also includes a 30-minute consultation with your Equilife health coach and a plan tailored to you. It's an absolutely amazing deal based on that hormone lab. We have the female hormones lab, which looks at progesterone and estrogen, and we have the male hormone lab, which looks at DHEA and testosterone. But instead of paying the $129, which you can, and it's a great deal, we are giving away 500 completely free this week. That means on all qualifying orders over at Equa.life, you can get yours completely free. $250 for the female, $250 for the male, while supplies last. Check out the qualifying order details over at equi.life for all the details. Take care, and of course, let us know if there are any questions. Enjoy.